Can I call upon Dr. Rita Hepsi Rani for the presentation?
Good afternoon to all. My topic is efficacy of injection BOTOX in hemifacial spasm. So it is a chronic neurological disorder characterized by short, involuntary, frequent, clonic, tonic contractions or twitching of the muscles innervated by the facial nerve. It is usually unilateral. There are two types, primary and secondary. Primary, the most common etiology being vascular loop causing compression of the facial nerve. Secondary causes are tumors, demyelinating disorders, injuries, infection and brainstem lesion, etc. So here few movement disorder. Whenever there is movement involving the orbicularis oculi muscle, it is called orbicularis myokymia. So whenever this involving half of the face, it is called hemifacial spasm. Whenever there is both the orbicularis oculi is involved, it is called essential blepharal spasm. And whenever the BEB plus lower half of the face is involved, it is Meek syndrome. Whenever it is along with the neck muscles involved, it is called the Bruegel syndrome. So the mechanism of action of BOTOX injection A is, so there are from A to G it is available. Commonly used available form is injection BOTOX A. So it acts in the presynaptic nerve cleft and it enters the cleft by endocytosis, and there is dislodgement of the light chain and heavy chain occurs, and the light chain interferes with the snare proteins and prevents the acetylcholine receptors release to preventing the muscle contraction. Aim of the study is to determine the therapeutic outcome, efficacy and adverse effects of injection BOTOX in hemifacial spasm. Study design is a prospective cohort study conducted in the Government Medical College in Tamil Nadu. For study period, it is followed for 5 years. So all the patients were with the hemifacial spasm after getting the neurological opinion were included in the study. So after collecting all the socio-demographic details and neuro-ophthalmic evaluations, and MRI brain was taken to rule out the primary cause, that is the vessel compressing the facial nerve. And reconstitution of the injection BOTOX is available as a powder in a compressed form. It may be available in the 50 international unit or 500 international unit. So 4 ml of 0.9 normal saline is added and dissolved gently so that each ml contains 25 international unit concentration. The typical dosage for injection BOTOX is around 20 to 40 units per site. Method. So it is loaded in a 1 ml tuberculin syringe with a 30 gauge needle, and it is ready for injection. So by marking the visible areas of twitching, injection BOTOX A can be injected. Follow up for weekly for 1 month and monthly for 1 year and 6 monthly for 5 years. Patients at each visit, they screen for persistence of symptoms, recurrence and side effects such as dry eyes, lag of thalmus, ptosis, bruit and deviation of angle of mouth, etc. So in our study, 80 patients we gave injections, and commonest age group is around 51 years. And it's more common in female, it's common in left side, and it's mostly unilateral. So systemic commonly associated illness is hypertension. And so most commonly the area involved are eyes, nasal fold and mouth. And the peak effect is obtained during the second week of the after giving injection, and the duration of efficacy it stays for 5 to 6 months. In few cases it lasts for 7 to 8 months also. So the commonest side effects are bruit. So it is overcome by making use of 30 gauge needle with a single prick, and after giving the injection it is compressed with cotton soaked in cold saline, and dry eyes. So it is avoided by giving injection away from the muscle of riolan. And lag of thalmus is very most common in our study. Compared with other studies, ptosis is very common. It causes most some cosmetic disturbances. This is because we are giving the injections the preseptal part of the orbicularis oculi instead of the pretarsal part, and deviation of mouth and ptosis and persistence of symptoms are there. So these were my reference, a short video. So here we are using a 30 gauge needle little away from the eyelid crease. That is the preseptal part we are giving. Because if you are giving perpendicularly, the LPS is involved and cause ptosis. But here initially we had 3 cases of ptosis, but it is avoided by placing the needle horizontally. So the ptosis, we didn't get any ptosis as a complications. So this is a superficial muscle. While giving the nasolabial fold in zygomatus major and minor, we can give the injections in the vertical manner. Thank you.
How long does the effect last?
So most of the cases it is around 4 to 5 months, madam.
And then you repeat it?
Yeah, repeated injections, that is one of the side effects.
Thank you.
Otherwise the patients are very happy. Thank you.
Thank you, ma'am.